Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing the medication known as Imipramine. Its brand name is Tofranil. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find this information to be valuable, please consider leaving a like on the video as it would really help me with the YouTube algorithm. So first, what will we cover in this presentation? We'll start by talking about how imipramine works. We'll then discuss indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe imipramine. We'll then discuss examples of dosing, and then stick around to the end where we'll talk about side effects. So how does imipramine work? Well, first of all, imipramine belongs to the dibenzazepine class. Its mechanism of action is thought to involve the blocking of the uptake of norepinephrine at nerve endings. In terms of indications or reasons we would prescribe this medication to a patient, we often see it used to treat depression. It can be used to treat nocturnal enuresis, which would be involuntary urination throughout the night while you're sleeping. And there's also some off-label uses as well, such as binging, diabetic neuropathy, panic disorder, and urinary incontinence. With respect to contraindications or reasons we would not be able to prescribe imipramine, one would be if a patient had a hypersensitivity to imipramine or to other dibenzazepines. This medication cannot be used within 14 days of a monoamine oxidase inhibitor, and it's also not to be used during the acute recovery period following a heart attack or myocardial infarction. Now what about dosing with imipramine? So in depression, if the patient is using this medication in hospital, they may use 100 milligrams orally, daily, given in divided doses. The maximum dose would be 300 milligrams per day. Now if they were an outpatient using this medication outside of hospital, they would use 75 milligrams orally, daily. The maximum dose in this situation would be 200 milligrams per day. In the off-label use of diabetic neuropathy, a patient may use 25 to 150 milligrams per day, given either once daily or in 2 divided doses. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using imipramine, so I'll go over some of those here now. Some patients may experience weight gain or constipation. Some may experience xerostomia or dry mouth, as well as asthenia or abnormal weakness. Dizziness, headache, and somnolence are possibilities, while some patients may experience blurred vision, urinary retention, fatigue, or bloating. Now, some more rare but serious side effects would be worsening of depression or decreased liver function. That's all we're going to talk about today with imipramine or Tofranil. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.